Miss Jasmine Patel. Please come on up. Jasmine is not just my sister from another mister, but she is a strategic advisor to the foundation. Her professional career is focused almost completely on patient advocacy. She's an expert on diversity, equity, and inclusion, and we thought, what a great person to moderate this next session that's so important. I almost wish it was in the beginning of the day so that we had a full room for this, but please come on up, Jasmine.
All right, I would love for my fellow panelists to come on. All right, one step closer to the social hour, AKA the alcohol. So yes, this panel is quite literally about achieving health equity for all. We're really going to explore some of the challenges, but also the opportunities. My name is Jasmine Patel, and I'm so happy to be moderating this panel. So we've met mostly everybody here, but Marie, if you can just please introduce yourself, tell us where you're from, and then we can get straight into the discussions.
Hi, my name is Marie Abrego. I am from New Mexico, and I am 31 years old.
Thank you, Marie. So health equity is such an important topic, as is diversity and inclusion. But really, when we're talking about health equity, the Samaya Foundation, we really just want to make sure everybody, no matter who they are, where they're from, what they're focused on, they have equal and optimal access to health care across all diseases. But of course, in this respect, we're talking about NMOSD and MOGAD. So with that in mind, my first question is to all of our patients on this panel. Talk to me about some of the challenges that you've faced going through diagnosis and treatment as it relates to maybe some of the health disparities that you've faced in your own journey. Avery, I can start with you. Also, just some information about Avery. Avery has her own organization in addition to her being an ambassador for TSF. So Avery, if you want to talk about your foundation and then also talk about some of the experiences your patient population faces, we'd love that.
Yeah, absolutely. So my name is Avery Allmond. I am a TSF ambassador. I've been for multiple states now. And I was diagnosed in 2017 at the age of 19. And being an advocate and kind of seeing all of the disparities that are within the rare disease community, it really made me want to kind of attack the situation that is diversity and inclusion in healthcare. And throughout my journey, I know one of the biggest things that I faced was the financial aspect of being able to afford this, being able to afford it being rare. And it's an unfortunate thing that it's not something that we ask for, but it is something that's a big problem because affording care and even things like being able to get to appointments where you can get your care. A lot of people have to travel miles and miles to be able to access health care. And so focusing on things like this within TSF and Couch Pennies, I think we can really address what's needed in the rare disease community.
Absolutely. Payton?
I would say, I think as a child, definitely I felt like a guinea pig. I'd always tell my mom, I feel like I just keep having episodes. They're not really consulting doctors outside of our network. And I really didn't feel like, as a patient, that I was cared for until I came to UCLA. And the only reason that I was able to meet Dr. Sue and be a patient at UCLA was because I was a student at UCLA. So of course, ultimately everything happens for a reason, but for almost 10 years I felt like I wasn't being heard, and I was just kind of like, you know, a test dummy. So yeah.
Thank you. Marie?
Accessing care in New Mexico was very hard because, so when I was diagnosed, of course, they rarely were starting to learn about the disease, but the specialist that was supposed to be the specialist there didn't know, of course, too much about the disease. And it was hard because I felt that because I am Hispanic, and I was young at the time, that they weren't listening to me when I was telling them. Now, of course, my parents could advocate for me, but there was also a language barrier. So because of a language barrier, our voice wasn't being heard. And that's where it became hard. I, of course, incurred mental disability. I am now blind in both eyes, and I use a wheelchair heavily.
And Marie, you you don't live in a quote-unquote very urban area, and so tell us how long it takes you to go and see your doctor.
So I go. I no longer receive care in New Mexico because I got very, very, very sick. Let's just say they told my family that they weren't so sure if I would live. So I go every 6 months, 7 hours away from my house to receive care. And even though I have to travel every 6 months, 7 hours away from my house, I am very thankful that I am in a position to do so.
Absolutely. And so all of you are here today because an organization, the Samira Foundation, has put together this event for all of us to come together. But tell us about the impact that patient organizations in general play in making sure that you're a much more informed, empowered, and overall just somebody who's able to communicate more effectively to everybody you're speaking with, whether it's your friends, your family members, and especially the clinicians that you engage with. Marie, I'll start with you at the end, and I'll come back this way.
So the Samira Foundation has played a big role in having me get educated. Before the Samira Foundation, I wasn't really educated about my disease. So I knew I had NMO, okay? But I didn't know the type of NMO that I had. I started to be introduced to like the Facebook groups and just little things like that. And I would see patients say that they had their aquaportin 4 positive, MOG positive. And I was like, what in the world does that mean? What am I? And I said, all I know is I have NMO. But then I went back to my doctor and I told my doctor, so I'm seeing all these patients say all these things all over the place. I see, you know, the Samira Foundation educating their patients about aquaportin 4 positive, MOG positive, and also seronegative. And I was like, what do I have? And he was like, I was actually waiting for you to come to me to ask that question because, of course, he said, you had already been through so much. I didn't want to, like, freak you out anymore or, you know, stress your body out anymore. So I was waiting for you to come to me, which I'm glad he did because if not, honestly, I would be scared in my boots.
Personally, it was really important for me to invite my grandpa and my mom here because they've always been very important advocates in this journey the past basically my whole, almost my whole life, because I'm still rather young. But this is actually the first year that I've heard of the Samira Foundation, and Dr. Sue actually invited me to this event, which is the only reason why I actually, again, am I participating. So I'm very thankful for that. But we were part of the NMO Ali Guthie Foundation for a couple years. But I think when I was re-diagnosed only a year ago, it was so surprising for all of us. And we had already been through so much with learning that I had NMO and so much research. And there was just a lot of time and energy and mental space that we kind of invested into learning about NMO, and then to find out that we didn't have it, or I didn't have it, it was kind of draining to learn about another disease. So being here today has really taught us a lot more about what I actually have. I mean, ooh, excuse me, it's really late, guys. What I actually have, and so, yeah, I think that's what's been most important to me.
Really quickly before we go on to Avery. Payton, is this your first time being around this many patients?
Yes.
Yes. I don't know, in one word, tell me how that feels.
Just
and come back.
Word, just one word.
Yeah.
Can I? Yeah.
Come back. Okay. Avery.
So patient advocacy organizations, I think, are the most important part and most important piece of having a rare diagnosis. When you Google things, a lot of the times the things that come up are from patient advocacy organizations. And even just like what she was saying, it brings together community. Events like these allows us to not feel alone, and we can connect with each other. And so it brings community, resources, and connection, and that is truly what's going to help patients be able to navigate their journey.
Can I piggyback off that?
Yes, please.
Okay, so finding the Samira Foundation has brought hope to me, not just to me, but to my family, to know that, organizations like the Samira Foundation really helps patients and their families and caregivers to kind of really know about the disease and not to be scared about the disease. So it's brought in me and my family hope, and we're so thankful for the Samira Foundation.
Thank you, Marie. So Dr. Amezcua, I'm going to shift to you. Obviously, this is a topic that you're very passionate about. I know you're doing some research in this area. Can you share some of the research that you're focused on right now? And then secondly, in your own practice, what are some of the things you have put in place, whether it's individually or your entire healthcare system, to address and help really move the needle forward for some of these health disparity challenges?
Well, first of all, I'd like to acknowledge the different lived experiences that each one of them has just shared. And as long as I've been working on this, over 10 years, I still get emotional because it's been over 10 years working on this, and yet I'm still hearing the same problems. What we're facing is still the issues that, which are the same. These social determinants of health that just keep on impacting our outcomes, our patients' lives. And so, yes, I'm very, very much passionate and understand that all of us have capacity to make changes. Of course, we're here as clinicians, and we know that deciding on the right treatment is important, but it's also remembering that the disease doesn't stop at the clinic. It goes back to the community. And we need to better understand as physicians what are each patient or each community facing? What are the struggles that each one of them has? Do they have access to a specialist? Certainly, we've come to understand that despite living in the United States and we spend so much money in healthcare, we have little accessibility to neurologists and less so to specialists, and that there's certain communities that have even less access to that specialty care, whether it be geography or by certain characteristics that has placed us as marginalized, be it the color of our skin. And so certainly I'm trying to better understand how these social determinants of health impact that access to care, the utilization of care, by looking at just simple questionnaires. These lived experiences are really important. These lived experiences have capacity for me to come up with a solution, but it's going to require that I listen to them and I listen to their communities and where they're at. One of the things that we have done and we're trying to do, and earlier today, people talked about this clinical care navigator. Clinical care navigators have certainly been instrumental in and continue, and they're paid for cancer, but they're not for chronic diseases like these. And why is that? So somehow we need to be an advocate, but we need to show that it works. And one of the studies, which is part of a grant, is basically to test that feasibility, acceptability within a system. So system-based projects to see if we can actually modify the system, because in the end, it is the system that we're working with that is also a barrier. Simple things like making sure there's there's translational services available. That can have a huge impact. And we did that many years ago for working with the General Hospital for LA. The other things that are important is making sure that everybody has access to these disease-modifying therapies that are now available. And whether they FDA approved or the ones that we tend to use sometimes because the other ones are not accessible, but they also work, rituximab. So that was something that I worked about 7 years ago with the Department of Health Services, which encompasses all of LA's four important hospitals, and it was to make certain that that was even just accessible to neurology, because neurologists could actually didn't have the ability to prescribe it. We had to go through hoops to use it, and then working with whatever federal systems or things that are in place to bring down the cost of medications down so they can be more accessible to our communities. So those are some of the issues that, some of the things that we're working on. But what I'm also working on is to try to better understand what are the differences of the experiences, but also the outcomes that are related to different lenses of diversity and inclusion. Race and ethnicity is really one of the top lenses that we commonly use, but we know that there's other important characteristics that sometimes lead to, from racism to less accessibility to care. And so we just need to take one at a time, but certainly right now is the right time. And in order to make a change, again, it's not going to be me, myself, but it's going to require community involvement, diversifying my stakeholders, having the voice of our patients to come up with equitable solutions.
Yeah, and it kind of goes back to what we were just talking about, diversity in clinical trials. If we have more diversity in clinical trials, we're able to see how these clinical trials affect people differently, and that can really have a long-term impact on who gets access to treatment in a timely manner. And we're talking about as well making sure that patients have a seat at the table. Part of them being able to do that effectively is also making sure that they are educated enough so that they can be part of those robust discussions in a way that they can contribute their perspectives in a meaningful way. And so not everybody knows about clinical trials, how they work. Not everybody knows how clinical endpoints are determined. When a clinical trial protocol is developed, how do we make sure that it's actually relatable to the person who's going through the clinical trial? And so this question is for you, Dr. Amezcua, and also to our other people on this panel. In what ways can we make patients more informed about just beyond their disease so that they can be part of these solution-oriented opportunities?
Well, first of all, it starts with, foundations like this that actually believe that there is a problem with equity and inclusion, and in supporting programs that not just speak about the disease, but also speak about what, and we heard earlier, what is a clinical trial, what is an observational study, and then gaining the trust, because the unfortunate thing, the reason we see lack of participation and representation comes down to several things. And it's not just an issue of the patient. It is an issue of a structure of where the clinical trials are conducted. They're mostly in urban settings, in institutions, right? It takes a while for certain populations to get to those clinical trials. The other one is obviously the historical things that happened in the past from a Tuskegee, trial that led to a lot of mistrust of the system, and for good reasons. And so we need to regain the trust of the communities for participation, and for them to feel welcome, and then for us to be also facilitators in the participation of the clinical trial, because participating in a clinical trial may take an all day. And so that means taking an off day from work, needing a babysitter all day for those that have children. And so we need to come together and meet them halfway to see what are their needs, and so we can diversify and, again, bring more generalizability to our outcomes.
Marie, Payton, Avery, any comments?
Yes, I have a comment. So when when the disease started to progress, there was a talk of me trying to get on a clinical trial, but the doctor at the time said that I didn't qualify for the clinical trial because I was no longer walking. So that broke my heart, of course. Then that doctor retired, and I was, of course, getting worse. And so then I got referred out of state, and my first appointment with my neurologist was not just to discuss what's going on, but what treatment we were going to go to. Now, he told me there's another treatment that you can go to, but because you're not walking and because you're blind, you don't qualify for it. And so that broke my heart again, because after a person loses their eyesight completely and the ability to walk completely, they want to do anything and everything. They're willing to basically risk their life to still be able to live and to, try to have all what's going on to them just stop so they can at least kind of live a semi-normal life. So what I don't understand is with clinical trials, why won't they let someone that's lost, the ability to walk and the ability to see, why don't they let them join the clinical trials? To me, they don't have anything more to lose. They're kind of in a crisis mode.
Yeah, it's a very good question and a very good, question to not just us, but those here from pharmaceuticals, to think about our current inclusion and exclusion criteria. And it's something that I think we can all say we battle with, whether it's age, whether it is, disability level or duration of disease. These are commonly, people are excluded from clinical trials. And so that calls for us to start thinking about ways to better measure outcomes. And so in your case, it is likely because the current outcomes that we use are not sensitive enough to capture changes after a certain level of disability. And so we need to do better to come up with better measures so we can be more inclusive.
Yeah, I mean, the key word there is patient-reported outcomes. It's a big deal, and you make such a good point, Marie.
It was very hard to hear the word no. Early on, when I was first diagnosed, my ophthalmologist told me, don't ever accept no for an answer. So when I was told no, after going blind completely and losing the ability to walk at a very, very young age, it was very heartbreaking, not just to me, but to my family, because the doctors told my family that I had a chance of dying.
Yeah, thank you. Despite all of this, you are one of the most happiest and positive people I've ever met. Seriously.
And Marie, I think you should be a part of, when we heard this earlier, part of, advocacy. I know you're here advocating, but consider being part of a clinical trial as a stakeholder, sitting at the table and telling your experience.
I would love to do that.
Payton, Avery?
I think we can all say that these diseases don't discriminate. It doesn't matter what shape, size, color, sexual orientation, background, it doesn't matter. Anybody can be affected by these diseases, and I think touching on the conversation of trust in our system, unfortunately, we live in a world where systems do discriminate. So when we have patients and physicians and people up here that are of the lesser served communities, and we see people that look like us, we can start having those conversations of trust and what we can do to have that from patients, because it's important, and in order to have diverse clinical trials, it starts with the trust in the patient and changing that system that we currently have to live in.
Definitely. Payton?
So our voice needs to be louder.
I would honestly just second what everyone has said so far. Just ultimately communication with the doctors and the patients. I'm not sure if doctors are notified, like if they get an email notification or an announcement, there's a new clinical trial, how it all works. I would love to learn more about the process, but I just know that growing up, I would just always be on the back end of things, or the front end, I would say. They're testing a medication now, so I'll let you know about that, and then I'll have an episode, and then, so just, I guess, more communication. I'd love to get an email announcement if that's a thing. But yeah.
Yeah, definitely. And I think also, it's a very important cycle from start to finish. So when the clinical trial is being designed, patients are going through it, the data is published, we also need to make sure that data is not only understandable to clinicians, it is understandable to patients and these patient organizations who are ultimately going to be the most important voices in advocating for access to these treatments when they become available. And so, there's this concept of plain language summaries of publications that I think is extremely critical for people to consider, especially the therapy makers as they're publishing their data, complementing it with a plain language summary. And then same thing goes for guidelines. When these insurance companies are deciding their formularies, oftentimes they're seeing what the guidelines say and they're designing their formularies based on that. And when there are access issues, the first voice to be elevated is the patient voice, is the advocacy organizations. And again, plain language summaries of these guidelines help them even more. So we have 47 seconds and counting down. Any questions from the audience? Yeah.
So I think as I was diagnosed the week of my 20th birthday, and a lot of my symptoms were kind of chalked up to just being like, oh, you're a stressful college student. So as young women, what are some helpful things to advocate for yourself to doctors and your medical team to be like, I know something's wrong, but a lot of times it felt like I'm not listened to?
Persistence. I'm on the phone, I'm a student too. I'm on the phone with insurance. A lot of my week is dedicated to talking to insurance, simply because they don't speak with one another, and that puts a lot of stress on the patients. So I would say persistence and being bold as well when it comes to advocacy. Yeah.
And be confident in what you're going through in your journey, because you know what you're going through, even though other people can't see it. So if they want to call us sassy young women that, you know, are just having hormonal issues, use that to your advantage. Be a sassy young woman that advocates for herself.
And, you know, now there's great organizations that have resources to help you have those conversations. And so I would say reach out to these organizations, leverage the tools and resources they've created for you, and help you with your conversations. And before we close, Payton, what is your one word to describe your experience today?
I forgot to think. Okay, I would say united. It really feels like a lot of the time I kind of, throughout my journey, I was, you know, a normal girl just going through something that none of my friends or, you know, counterparts were going through. But when you finally meet a group of people who actually lost their sight from what you also lost your sight from, or have gone through a number of different symptoms just as you did, it's a lot more, you just feel more comfortable with talking about your disabilities and various things that you've gone through. So what was the word did I say?
United.
Yes, united. Thank you.
All right. With that, we'll close this panel. Thank you.